What the heck is robotic process automation and how does it apply to revenue cycle management? In other words, RPA for RCM. My guest today runs a very successful RCM company that takes leading the way with new technology very seriously, and he's going to tell us what all of this means. I'm Carl White, principal at Market Advisory Group, which is a healthcare marketing agency, and I'm also the host of PracticeCare. The mission for both is the same, and that's to help private practice owners stay private. Usually that's what they want anyway, but care is better when the provider owns the practice because that's when they're going to have the most freedom to make the clinical decisions they think are best, spend the amount of time with patients that they think is appropriate. They get to call the shots. It's just not always the same when somebody else owns the practice. They can govern the schedule, they can get involved in treatment decisions, they can just give the provider more things to think about. Let's keep it simple and keep it private. My guest today is Vinny Sankaran. Vinny brings over 15 years of experience in operations, financial analysis, strategy, growth, corporate development, strategic planning, and marketing. At Medical Billing Wholesalers, he's involved in applying his experience to optimize revenue cycle process flows to improve their clients' profitability and performance. And there's a lot more to it than that, which we're going to get into. But anyway, Vinny, thanks for coming on PracticeCare.
Thank you, Carl. Thank you very much for inviting me. I'm excited.
Yeah, absolutely. Every once in a while, we have an episode about kind of new tech, what's new. Not so easy to find people who know what they're talking about. So this is going to be a good one. But before we get into that, RPA, RCM, EIEIO, let's just start with where I start with every guest. And that was a short bio that I just read. That's what I asked for, though. So tell us more about you. Fill in the gaps for us.
Sure, I could definitely do that. So I have been in healthcare since for about 20 years now. RCM a little over 15 years, but before that, still in healthcare, different things, medical tourism. Before that, I was helping nurses actually move from India and Philippines to the US. So pretty much all healthcare, with hospitals and things like that. So I've been in healthcare. US healthcare is complicated, as everybody knows. I know today we're going to talk more about technology, and that is also something I've been involved with for many, many years.
Mm-hmm.
So MBW, or we tell people that it's the BMW of medical billing, right? It is complicated.
Medical billing wholesalers, yeah.
Right, medical billing wholesalers go by MBW. So there is a lot of need for medical billing, but over the years it's changed, right? So first we had EMRs, before that you had paper charts, and then you had EMRs, and then there's a lot of changes with HIPAA, right? HIPAA was more for patient information and compliance, which is still true, but with technology they had to add the high-tech piece that is more the EPHI, as they call it, electronic patient health information, and a lot of things change. Same thing with technology, it changes. So we've run a successful business. I think we started with about 3 employees, and we have about 400 employees doing billing, coding, credentialing for various providers in the US, some hospitals, but I would say the majority of them are, practices privately owned, like you said, small, medium, large, some facilities like urgent care, ambulatory surgery, but most of them are office-based physicians. And we do a lot of different things for them based on what they need. Sometimes the full revenue cycle, sometimes part based on what they need.
Okay. And a variety of types of practices. Like
variety of practices, pretty much all specialties. The only thing we don't do is, I think, dental, and the DME is durable medical equipment. We don't do that. These two are things we don't do. But apart from that, pretty much all specialties and all EMR practice management system. At one time, they had over 1,000. Now it's not that bad. Now I would say we still use, I would say, 25 to 30 different systems, because some are specialty based, some are hospital based, some are, office based. So over the years, we've just kind of seen that all. So once you know 5 to 7 systems, the other ones are not that complicated.
Right, because the data it's collecting and housing is always the same. So how much variety can you really have? But still.
Correct.
Yeah,
Correct.
but still. Okay, good. So let's get into it. Robotic Process Automation, RPA. Let's just make sure we're all talking and listening about the same thing. What is that and what is it not?
Great. So robotic process automation, or RPA, is just regular automation. So the goal is to take something that a human does and make it easier and more efficient. So you're trying to automate the process. The best analogy I can give is like Excel has something called macros. You can actually record a macro, and you have to actually teach it. It records everything, like a keystroke recorder.
Yeah.
And if you pause it, it'll do exactly the same thing. It's not going to learn. It's not going to get intelligent. It's not going to change anything. So if something in the system changes, it will break.
Okay.
Same thing. That's the best way to describe RPA. So it works when a process is manual, repetitive, and rule-based.
So it never
That's when
changes. It's always the same
you,
from step one to step
correct.
finish. Okay.
Yes. So you do it. So the best way to do RPA is take a process, break it down into smaller pieces, and make a bot, as they call it, right? So each of the process can be called a bot, right? And you make a bot for each process. So it's easy for you to track. And if something breaks, you know exactly where it broke.
Okay.
So let's say there's a task that you're doing, Carl, that has 10 steps. Instead of having one bot that does 10 steps, I'm not saying have 10 bots, maybe three is a good number, maybe two. It depends on how complicated the process is, how many moving parts there are. And as you make the bots, you will get an idea. Okay, this
Sure.
makes sense. So let me give you an example. When we're doing revenue cycle management, let's say you're doing claim status, right? You have a lot of claims. You want to actually go online and check the status of claims. So you have a lot of insurance companies. You don't want to make one bot that goes to all insurance companies. Make one bot that goes to United, one bot that goes to Aetna and Cigna. It's easier. So if you know there's some change that United made on their website and it breaks, you go and you can fix it easily, as opposed to going to all the websites and checking to see which one. That's just an example.
Okay. And what is RPA not? Is it AI? Let's just start with the obvious. You can't have a conversation today without saying AI. So let's just get
That
it
is
out of the
true.
way.
That is
Let's
true.
just get it out of the way. Is it AI?
Perfect. No, but we can use RPA as part of AI. So let me say AI is artificial
I thought it
intelligence,
was
right?
clean and you just made it dirty. So keep going.
Yeah. let me. So AI is artificial intelligence, right? RPA does not have any intelligence because it's like I said, you record something, it does exactly the same thing over and over till it breaks, or you go in and change the code. So there's no intelligence, there's no pattern recognition. It doesn't get better with time. Nothing like that happens. AI, on the other hand, there's a lot of different things. Now we talk about generative AI like ChatGPT. It's really intelligent. It gives you meaningful answers. You still need human supervision, right? Because sometimes it can run wild, it can hallucinate and give you
Right.
answers
Crazy
that are not
answers.
true. That's
Yeah.
all AI. You don't have all that issues with RPA. But
Okay.
when you're building an AI platform, right, you use a lot of bots sometimes to do the little work. So
Okay.
let's say you want to build a big thing with AI. So in RCM, AI is also used. It gets a little complicated. We're not going to cover it in this podcast. So
Yes.
let's say we're making one tool for same thing, claim status. Now what RPA will do is just get you the claim status. It will go and put the person's name, date of birth, let's say social security, and just say if the claim is, let's say, processed by the insurance company, rejected or something. Just one or two things the RPA does. Then with that data, AI can actually get meaningful information and get you patterns and say, it usually takes 7 days to get paid. It gets 5 days to get denied, 21 days in this insurance company. So those data mining, anything like that, the AI part can do, but RPA cannot. Did
Yeah.
that I
It
help or did I make it more
it does. I'm gonna
confusing?
in my simple little mind, I'm gonna say AI has the chance to think, whereas RPA does not.
Perfect. That works.
Okay. Yeah.
That
Okay.
works.
Yeah, because the reason I ask is because just zeroing in on AI is because I just see a lot of what people are calling AI, and I look at it and I go, I don't know. I'm not sure. Partly because I'm not sure the full scope of what AI is and is not. But yeah, some is just like a repetitive process and you're making it hyper efficient.
That's it.
Let's not call it AI. Like it's just people are going to get lost in what it is and isn't if everything is in it, you
I
know?
agree with you 100%. But like you said, AI is the cool term now. So they just want to use AI, even though
Yeah.
most of it is just regular automation and
Yeah.
nothing to do with AI. But
Okay.
yes, that is
Okay.
correct.
So what else is RPA not? Like when you think about what you know about just to help people understand what it is and isn't. It's pretty clear to me. It's
RPA can be used for simple tasks. It cannot think, like I said. So RCM has a lot of moving parts. There's charge entry, payment posting, coding. So it can be used for a variety of these things, but it cannot be used for anything complicated like, let's say, denial management or AR analysis to find out, okay, why something is not paid, or you can't use RPA to call a patient or an
Mhm.
insurance company. So, complicated tasks that involves analytical skills, thinking, any common sense, any intuitive stuff, things like that, RPA is not.
Okay.
Anything, that's why I mentioned, right? Manual, repetitive, and rule-based. All three are very important for RPA to work.
Yeah.
If you don't have one of these three, it is an issue. So
So
anything, yeah.
can RPA handle a conditional, like it gets to step 5, and if step 5 is the answer is yes, go this path. If the answer is no, go that
Yes.
path. It can do that.
Yes, you can do if then analysis. Again, it's very rule based, right?
Yeah,
If
that's
you're
why I
basically
was.
saying if it's
Yeah.
red light, stop the car. If it's green, go. So same
Hmm.
thing. You could have more than one if. You can have if
Hmm.
then. But like I said, keep the bot simple. A couple of if thens is great. 25 if then statements complicated.
Hmm.
You don't want to do that.
So you've given a few examples of good uses and bad uses. If you could just give a few more so people who can start to wrap their head about. And I'm interested also in like the frontier, like where how complex could a process get? You say, it's still good for RPA. Whereas after that, I don't know if it's quite that crystal clear, but just kind of your advice.
Right. It's not that clear because there's a lot of moving parts. The healthcare in US is really complicated. So
Hmm.
what a hospital will use a RPA tool is very different from a smaller practice as opposed to a bigger practice, right?
Right.
Because they have different issues with our RCM, so they use it a little differently.
Hmm.
I'll tell you what we have used it for, and I'll also
Yeah.
tell you what I've seen other companies like in billing companies use, and also bigger practices. A very small doctor practice, it doesn't pay for them to get into RPA on their own. It's better to go through a vendor. Same
Hmm.
thing, like but a hospital can have a small
Sure.
team that can handle it, and we'll come
Sure.
to that. So we used RPA for very basic things. So we had our employees come in the morning. There are a lot of things that we have to download. So, data is there in different places, data warehouses. So let's say it's an e-bridge. It's a thing that we use for RCM. There's Dropbox and Box, HIPAA compliant stuff. And there are a lot of EMRs and stuff. We have to download data files. Just this downloading before they could start work was taking 5 people about 2 hours a day,
Oh my God.
right? Right. But don't forget, this is stuff they're preparing for hundreds of people to do the work. But
Yeah.
we're talking about 10 hours a day wasted. So that was the
Yeah.
first thing we thought, hey, low hanging fruit, let's start. So
Hmm.
there's something, and there are different kinds of RPA bots. So this is a scheduled bot. So every day at 3 a.m. or something, we would tell the bot to run. It will automatically run. And if there's an error, it'll email you. Either way, it'll email you in green saying it was successful or in red saying it failed. That
Okay.
way, when in the morning you come, you already know it's good. It went. So the download was done automatically. So we just saved 10 hours by that. So we call them download bots, and we have hundreds of these bots. So
Wow.
that just very simple we save, right? So you want to start RPA with low hanging fruit.
Yeah.
So two reasons. One is it doesn't take you so much time and money, and you feel good. Hey, I actually tried something. It worked.
Yeah.
Great. You save 10 hours a day. That's good. You have
Hmm.
tangible results and you move on. So we did
Hmm.
that. The next thing was what I talked about, claim status, right? So there's a
Yeah.
lot of claim status. You don't have to call insurance companies for everything. Only for some complicated stuff we have to call, and that is not an RPA thing anyway. The
Hmm.
human has to call and talk to somebody at the insurance company. But a lot of these claims we can just find online on their website. But instead of checking one by a person, we have a whole batch file in Excel. The bot goes one by one, copies pasted in, let's say, United Healthcare for right now, and it'll tell you the status and it'll populate the Excel. So it's faster than a human doing it,
Hmm.
obviously, and you can do it in the middle of the night, right?
It doesn't
And in
stop
the
to look at
morning,
Facebook for 15 minutes. It doesn't need
exactly,
breaks. It doesn't get sick. Yeah.
exactly. No
Hmm.
smoke breaks, no sick breaks, nothing like that. Everything is good. Now, and let's say we had 100 claims. The bot could only get answers for 95. That's great. The other five, nothing is there. It'll give you an say not available, not applicable, whatever you tell it to say. And
Hmm.
those five, a human can do it or make phone calls
Right.
or so. So
Right.
it saves you a lot of time.
Okay.
So that's another example. The third example I would say is running AR reports. So we run, AR reports, accounts receivable reports twice a month. And because we use 25, 30 different systems, there's a lot of things that we have to run. It takes, again, many, many hours. This is a little more complicated in terms of bot because this is called, we had scheduled bots. So those bots are already scheduled. This
Hmm.
one, you actually need a human to input the date range.
Oh,
Because
interesting.
so part of it, the bot still does everything, but you as a human give it the input and
Hmm.
then it runs.
Okay.
And there are other couple of RPAs. Sometimes in websites you have captcha. the bot cannot read that unless
Uh,
you get that captcha in your email. It can actually open your email, read the one-time password, and copy and paste. So a lot of complicated stuff you can do automatically, but sometimes you still need a human. And those are called like assisted bots or human assisted bots.
okay.
So hope that was helpful.
Who builds the bots?
We build the bots, but I'm just thinking how to address that. So
Okay.
there are softwares like operating system Microsoft, and we have iOS, Apple. These are the two main. So similarly, we have companies like UiPath, Automation Anywhere, and Blue Prism. These are like the big three.
Okay.
They're very good, but they're very expensive.
Okay.
And there are a lot of open source, just like an operating system like
Hmm.
Linux that is open source.
Right.
There are open source only for websites, meaning browser-based bots, and desktop or server-based bots.
Right. So you
And they
said,
have open source.
and you
Yeah,
said it's very expensive, but my head went to upfront cost perhaps, but you wonder like what's the break even on the time if
correct,
and like there's
correct.
a payback period that sometimes payback periods are totally unreasonable and sometimes they are. Um, does that change your I don't know these names, I don't know what they cost, but when you think of
Right.
it that way, does that change your
They do. They do. So these three big companies, I said, they are still really big. One of them is publicly traded. The others are, they're all in the evaluated in the billions of dollars. So they're big
okay.
companies, but a small doctor practice, it might not make sense because the license starts at about $9,000. You
Yeah.
can make a bot, but don't forget, right now, just to give you an example, we have about 250 to 270 bots running,
Okay.
right? So I might not need 270 licenses, but it's not one license
Mm,
because at one license, you can only run one bot simultaneously. Then you need another license. So it adds up. It's not 270
yeah.
licenses. Let's call it 100 licenses. That's still a lot and it's too
Yeah.
expensive. So we use some licensed ones and some open source. So again, it depends on you. And there are a lot of hospitals that actually have all the licenses. It pays for them
Sure.
and it makes sense. And they have an enterprise model. They obviously get a discount in pricing once you buy, I don't know, 50
Yeah.
licenses and so on. So
Yeah.
when I said expensive, I mean, don't forget these things will also fall down in price as
Hmm.
we go forward. Right now,
Yeah.
that's where it is. So we could
Okay.
use open source, we could use software.
Okay.
That yeah.
So one of the questions I had to ask you, I'll ask it, and then I'll ask you if it's even still relevant. And the question is, should a practice be asking their revenue cycle management provider about
Mhm.
process automation? Should they care? I mean, because I'm listening to you now going, how would I even evaluate that? Hey, are you using it? How do you use it? I'm not sure. I guess if you know a good from bad answer, maybe it's worth, but
Right, right.
I don't know.
Two different things, right? So I'm talking only from the RCM point of view, but a doctor's office also can use RPA for their own internal stuff. So
Hmm.
that's a different discussion, right? So if their RCM company actually has parts and or you're using a third party and they can recommend a vendor that is, pretty not very expensive
Yeah.
and can help, that's great. That'll be the best way to start
Hmm.
and they can find out. So there are two different things, right? If the billing company gets more efficient and they save money, they can pass on some of the savings to the doctor, which is win-win for everybody with
Right.
everything that's going on with the insurance company. The other thing is once they have RPA, good and ready, then they can look at the doctor's office and see, hey, maybe I can help you with some of your processes flow,
Hmm.
maybe some patient scheduling, some eligibility verification. If it is done in the doctor's office, some prior authorization can be automated using RPA. So you can have that discussion. Depends who's doing it. Sometimes the billing company does it. Sometimes it's
Yeah.
it's still with the doctor's office. So based on that, that discussion can be had. Or the other one is if the doctors or somebody like a practice manager or something goes to conferences like MGMA,
Hmm.
RBMA, HBMA, any of HFMA, those usually have some either software vendors or
Yeah.
who are not very expensive and they'll be more on a consulting basis. You might need them for a couple of months to set them up, but
Right.
you also need to maintain the bots because anything
You've
changes in the
mentioned this a couple
website.
times, like something breaks and oh my God. Yeah. You need to know, yeah, how to fix it.
It's easy to fix, but you need somebody there. You can't
Yeah.
go back to the consultant every time. It's complicated. That's why I said in the starting, make small bots easy to manage. If they break, only one little piece breaks. And so the constant
Yeah.
maintenance is required. So we do have a team of about 4 or 5 people who make the bots, work with our operations team, get a list of what the next bot should be. Does it make sense to make the
Yeah.
bot? And then also the maintenance is most of where they spend their time.
Right. Okay. Okay. Um, Interesting stuff. I mean, and I'm wondering, it's robotic process automation. How is it different from when we just say automation? Is it just a more like the full term? Is there, you know what I
Yeah,
mean?
pretty much. It's pretty much. You can
Okay.
drop the RP and just have the A. It's still
Oh,
the same.
okay. All
Yeah.
right.
RPA automation. It's just let's we're just putting more
More
meat on the bones.
complete.
It's
You are
technically
automating with a robot in some way, shape, or
that's
form.
pretty much because there could be other forms of automation too. For
Yeah.
example, you had paper charts, and now you move to EMR. That's already
Hmm.
kind of an automation, but it's a little different kind of automation. So just to differentiate between bots and different kinds of automation, I think they have. This is more specific kind of automation, but it's still automation.
Yeah. Okay, cool. Um, Really interesting stuff regardless. And I'm really glad we had this because, like I said at the beginning, there's nothing new about being surrounded by tech, but finding people who know what they're talking about to have on PracticeCare, not as easy to find. So I'm glad. Couple of wrap-up questions I ask every guest. The
Sure.
first one is there anything you think we should have talked about or I should have asked you, but we just didn't get to?
Okay, just one thing I would like to add. I think,
Yeah,
RPA has been I mean, technically people have been using RPA for decades, but
right.
the last few years, there've been a lot of changes, especially after COVID. The price drop, like I said, and new companies have come out who have made it much more easy to create a bot. Before you had to really, really complex programming, Python, all that. You still can use all
Yeah.
that, but they
I know
made
I'm
it much
picturing
easier.
programmers going, I don't think so.
Right. And that would have made it expensive. It takes more time. So they made it very easy. Some of these programs, like I told you, Automation Anywhere and UiPath, more like drag and drop. They've already created workflows.
Hmm.
Even if you don't know a lot of programming, a little programming always helps, just the reasoning and logic, because you have to create the process flow and if then statements, but you don't need real programming. Just
Yeah.
drag and drop and rename it. So they made it really simple. And these open source came out in the last few years. So just like AI literally took off, literally what, a year and a half ago, the
Yeah.
ChatGPT, same kind of logic. RPA took off a few years ago. So I think everybody should look at RPA and use it with everything that's going on in healthcare, especially we're talking from a doctor's office point
Yeah.
of view. If they can save, let's say, 5%, 3% of time and money, they should definitely,
Because every
definitely look
summer
at it.
insurance comes out and says, well, we're whacking you a couple of points again. I
Yes.
mean, you can set your clock by that one. So it's almost
That's
automated. Yeah.
why to set up it takes a little time. So they have to be ready for the time. Time investment is actually more than the
Hmm.
money investment
Yeah.
because it's
Yeah.
not like writing a check and moving away because that's not how it
Yeah.
works.
Because you're learning something new. It takes more time.
And you understand your process. So if a doctor wants to implement RPA for their office, they need somebody who's an expert in their office workflow to explain to the programmer what they need done.
Hmm.
Because the
Hmm.
programmer has no idea how your office or the workflow works.
Right.
So
Right.
that's why I was talking about the time investment.
Right.
But once you get it done, you would be really
Yeah.
happy.
Which leads to the next wrap-up question. So we've caught listeners' attention. They're like, you know what? He's right. We need to get started on automation, which is a very broad way to say it. But we just don't know where to start. Do you have a couple of ideas, like
Yeah.
super simple, they could just get off the starting line and get going down the path?
Sure, sure. It depends on the size of practice. If you're a
Sure.
big practice and you can write like say 250, $500,000 checks, then talk to one of those big companies I mentioned. The great
Hmm.
way they have consultants, they have external vendors who will actually work on their software on
Hmm.
cheaper for you, and they will set everything up. But
Hmm.
it's the expensive version. The
Hmm.
other option is there's a lot of vendors out there. That's why I mentioned the conferences. If
Yeah.
somebody wants to reach out to me, I could point them in the right direction. This is not a service we do for others. This is more
Hmm.
an internal thing. And our clients, we obviously they get help because we use it to be more efficient. It helps our clients. But this is not
Yeah.
our business, right? We're a
Yeah.
service business. But I
Yeah.
know other companies that do it, and each one is different based on what their needs are, and there are
Hmm.
different levels of providers, right? Some are consultants who will like, hey, I'll charge you a flat fee for 10 hours and
Hmm.
we'll create a package for you. And some will take you all the way and build the bot for you, maintain the bot for you, like on a
Right.
SaaS model, saying each bot will charge you, I don't know, $1,000 a month to
Hmm.
build the bot, maintain the bot, so on. And it's like a IT company that doctors don't have in house, and they also
Right.
same logic, same logic.
Oh,
That
okay.
might be a good way to start. Talk to your IT company, talk to your billing company. If both of them don't have it, then
Yeah.
reach out to me. Hopefully I can help, or I'll
Yeah.
point them to the right direction in terms of
Yep.
conferences or vendors.
And your contact information is going to get into the show notes for this episode. Well,
Great.
one tip I've heard a couple here or there is Dr. X, you've got tech in your office today, maybe, and the good ones are adding features all the time. Maybe there's some automation built in that's just kind of buried and you've never
Right.
really thought about it. So you're already familiar with the, let's say it's your EMR. Maybe there's something
Mm-hmm.
in there. So have the rep come in and say, look, what kind of automation features do you guys have already? And maybe start there. You never know,
100%,
you know?
100%. Yeah, yep. Some of them have, like Cario does, Advanced MD does on the doctor side, and Epic
Mhm.
does a lot of automation on the hospital side. So
There you
these three I
go.
know for a fact, yes. And it's just like every software. There are 1,000 features, you end up using like 10 of them.
Like 10 of them. I
So if
know.
you
Yeah.
don't ask, you don't know.
Yeah. And
Correct.
you're probably paying for more than 10. And maybe some
That is
automatable tidbit is one of them. So yes, absolutely.
100%, 100%.
Perfect.
I agree
Vinny,
with
this
that.
has been great. It's funny when I first saw robotic process automation, I thought, oof, that sounds formal and official and wow, but it's automation. And so it's just like it's the full name of it. So this is but very helpful nevertheless. Um, and I like your other tip. You said it earlier, but something else is pick low-hanging fruit.
Yes.
Pick something like look around the office and just look at somebody and go, my God, they take a lot of time to do that. And it's not necessarily because they're bad at it or inefficient. It could just, if it's highly repeatable and it's always
Mm,
the same, it's step one to step whenever, just sit back and go, could that be automated? And likely the answer is
100%.
yes.
Correct.
Yeah.
So that's what you want to start with. You do that with RPA, only then you can take the next step to AI.
Right. And get comfortable with it. Just get comfortable with it. So perfect. So thank you for reopening our eyes to this, us here on Practice Care. And thanks for coming on.
Thank you so much, Carl.
Yeah. So like I just said, Vinny provided contact information. They're going to get into the show notes for the episode. So anybody who wants to contact him as he offered, now you've got another way to do it. Couple of points before we finish. First, if you're somebody like Vinny or us and you help private practice owners stay private with good business advice or expertise, or if you're a private practice owner yourself, same thing, you've figured out some things on the business side you think others would benefit from. Either way, we want you to come on Practice Care and tell the world about it. In the show notes for Vinny's episode and every episode, there's a link, couple of clicks. It's really simple. Just tell us what's on your mind so we can get you scheduled as soon as possible. And lastly, I say this every time, big fat broken record here. Subscribe to Practice Care. It's easy. We're everywhere. It's the easiest way to stay up to date with new episodes, which drop every week. So subscribe today and make your life easier. A little bit of automation right there. Thanks very much. And until next time.